Hello, my name is John Parent, and welcome to another edition of Frank and Mary. Normally, this program is hosted by Arthur Bergeron, who is a well-known local elder law attorney. But today, Arthur's job requirements preclude him from hosting this particular meeting. So I've been co-host for close to a year now on most of the programs, and I'm going to go ahead and host this one by myself. Now, I'm very fortunate today that we have a terrific guest. Her name is Kelli Calo, and Kelli is the Hudson Director of the Public and Community Health Department, someone who's been involved in the COVID-19 crisis right from day one. So Kelli, it seems like we're finally turning a corner, so I thought it would be timely to hear what you have to say about some of the changes. And before you do that, I did want to mention that I did talk to one of the members of the Board of Health, Jay Murphy. And Jay went on and on about the numerous accomplishments that both you and your department have had over the past year. So I wonder if you could just take a moment and kind of touch on some of the accomplishments that you've had.
Sure, I'd be happy to. Normally we love bringing in programs that support the town of Hudson. With COVID-19, it's been really difficult for us to do the majority of that this year because the majority of our focus has shifted from our normal day-to-day operations to only focusing on COVID-19. However, we still love the town of Hudson and love bringing great programs to the town. So we did apply for a few different grants this year, and we've actually received a total of 5 grants. So our first grant that we received is for a program called Emotional CPR. That was from the Metro West Health Foundation. That was a $30,000 grant. And that's to bring trainings to multiple sectors in the town of Hudson to teach them how to respond to individuals who have an emotional crisis. So if you see somebody on the street that's going through an emotional crisis, which could be anything from crying and having a breakdown to having a really hard break, it equips people with the knowledge in order to help them through that situation, to calm them down a little bit, and to hopefully get them some help. So that was the first grant that we received. The second grant that we received was for COVID-19 capacity building. With that grant, we were able to hire a community contact tracer. We needed the support. As I'm sure you all know, we just passed our 1,600 mark of COVID cases. We are currently at 1,602 since the beginning of the pandemic. So I couldn't do it alone. We did hire a public health nurse, and she couldn't do it alone. So we really needed some assistance. So that grant was to help us hire some staff to help us do the community contact tracing so that we knew exactly what was going on in our community at the time. The third grant was actually to support the emotional CPR training. That was an additional money from Emerson Hospital to actually bring that training to youth. We found that youth are going through emotional crises right now, and it's a really tough time for youth in this environment. And so we're able to bring the eCPR program right to them. The fourth grant that we received is for substance misuse prevention. So currently we host something called STAPC. So it's a Substance Abuse Prevention Coalition. That grant actually ends June 30th of this fiscal year. So June 30, 2021. So next year, next fiscal year, July 1st, we were going to lose our substance abuse prevention specialist. And that is a valuable program. I find that bringing substance misuse prevention to the town of Hudson, surrounding communities, to really engage our youth and to be able to prevent the misuse of substances is really important for not only the youth, but for our community as a whole. So we received that grant, and we are excited to have that grant that is $125,000 a year for up to 8 years. So we'll be able to sustain that program for quite some time. And then the final grant, actually, we just received word on Friday that we received a public health excellence grant. So what that grant is $300,000 a year for up to 3 years and may be renewed for additional years. But it's to support public health infrastructure. So we partnered with a bunch of different municipalities in the region, and we hope with this money we are able to hire 4 staff people to assist with fill gap services to the region. So we'll be hiring a director, a public health nurse, a sanitarian/health inspector, and an epidemiologist. Now that $300,000 isn't enough to bring those people on full time. However, we plan to seek additional funding to make those individuals full time. And Hudson is the lead municipality for that grant. And I'm excited that Hudson continues to be a leader in public health. And those are some great accomplishments that we've made this year.
Yeah, they certainly are. I know too, being on the Board of Selectmen, I appreciate what it goes into in writing some of these grants as well. They're never easy, and they're very stringent once you get them as to how you apply and actually utilize the dollars. Very interesting too that we always seem to talk about the physical problems of COVID. But another very real situation, of course, is that emotional, mental issue, the feeling of isolation, of not being able to communicate with members of your family, like grandparents to grandchildren, being in the house too much, not having that ability to be free and out there, and just kind of doing your thing. So I'm glad to see that some of these grants, are directed, towards that as well. You put out is it a daily report that you put out, Kelly, and it shows the week to week?
So we actually put out at the beginning of the pandemic, we used to do a daily report, and it quickly got very overwhelming. For me, I think at the beginning of the pandemic, I was probably working 80 to 90 hours a week. So I kind of cut back on that. So we do a weekly report. So it goes out every Monday, and that shows our COVID numbers from the previous week on that Monday. We also just recently started putting out a report every Friday, which documents the vaccines. So who in Hudson has received a vaccine and the percentage of the individuals and the age categories of who's gotten a vaccine in the town of Hudson. So that goes out every Friday. So we currently have 2 reports that go out, one every Monday, one every Friday.
Okay. Let me talk to you a little bit about the report that you just put out.
Sure.
And this is the one from Monday, April 26th to Monday, May 3rd. And if you go down to your weekly case counts, there's really definitely a substantial or a significant drop in cases if you look at from mid-December all the way through May 3rd. Now, I know that by and large, we're pretty much following the state when it comes to what phase we're going to adopt and that type of thing. Could you explain a little bit about the color coding? I know we're using red community, yellow community, and that would advise us and you as to what phase we might be entering into. So can you talk a little bit about where we're at in relationship to the state and their guidance and what we should be implementing or continuing to implement?
Sure. So the state recently, so I know back, I think September, October, November, they were huge into this color coding, right? Which made sense to some people, didn't make sense to other people. And it was just kind of just this map, right? So I would joke and I would wear wear a red sweatshirt or a red shirt if we were in the red, and during my meetings with other health directors in the region. So we're currently in the yellow, and we might remain in the yellow for a while. However, I think the state has recently moved away from using that map as to define where somebody lays in the reopening process. So everybody in the state of Massachusetts is following the same reopening plan that the governor puts out. So currently that map, which it used to relate to where you fall in the reopening process, is no longer the case. You're going to follow this reopening process, and that's just the way it is. So we're currently following the same guidance as everybody else, which changes almost daily, as it's been changing daily since the beginning of the pandemic. But the governor is hoping to reopen everything by August 1st. And I hope at that point, we have a lot more people vaccinated in the town of Hudson.
Yeah, let's talk about vaccines for a minute here too.
Sure.
When I got mine, and fortunately, both my wife and I do have both of the Moderna shots. And initially, we went online and wound up going to Foxborough, to Gillette Stadium, and having it done there. It does seem, unfortunately, that the number of vaccinations that are being given on a daily basis is starting to drop. I don't know how Massachusetts is in relationship to some other states, but there seems to be a couple of groups of individuals that one is thinking in terms of, well, we don't know what the long-term results of the vaccination is going to be. And I don't know how you really get assured of no negative results unless you wait 20 or 30 years before you get your vaccination. It seems to me that's about the only way you find out what the long-term results are. And the other, I think, simply seems to be a reluctance to trust the government or to trust vaccines in general. So what are you seeing well, first of all, is it easier today? I would think that it would be, from the ability to get an appointment. And what's the best way for those people who are maybe in that 16 and older category that have not received a vaccination as yet? What's the quickest, easiest way for them to set up an appointment and get that vaccination?
Sure, yeah. So at the beginning of the vaccination plan, it was nearly impossible to get the vaccine. People were waiting weeks. People were frustrated. They were anxious, and I completely understand. Unfortunately, our hands were tied for the majority of the time, especially when the governor cut off vaccines to the local boards of health. Our hands were really tied at that point, which was unfortunate because we hosted a few clinics, and we were really excited to bring the clinics to see the smile on people's faces when they came in for their first and second doses. It filled my heart with joy to really touch home. But the easiest way, and now there's a surplus of vaccines. The easiest way to get a vaccine, Marlborough Hospital actually has tons of appointments. I think they have the capability of vaccinating 500 people a day. They aren't nearly doing that. So the easiest way is actually to go on to Marlborough Hospital. I recently just posted on our town website the information on how to sign up for Marlborough Hospital. It's so close. It's a 10-minute drive for most Hudson residents, if not less, to go over there. Quick, easy, you're in and out in 20 minutes with the observation time for most people. So that is the easiest way. They have both Pfizer and Moderna, so they are capable of giving the vaccines to anybody over the age of 16, and hopefully soon anybody over the age of 12, because Pfizer is looking at decreasing their age category, so bringing it down to 12 years old, 12 to 15. So hopefully they'll be able to vaccinate 12 to 15-year-olds at that point. They also, Marlborough Hospital just announced today, and let me get up the email so I can give you the most accurate information. They just increased their hours and they're accepting walk-ins. So Monday, Wednesday, Friday, appointments are available by booking online, and walk-ins are welcome from 8 a.m. to 1 p.m. Tuesday and Thursday, appointments are available by booking online, and walk-ins are welcome from 8 a.m. to 5 p.m. Their clinic is located at the Marriott Courtyard in Marlborough. So they are making it really accessible for people to get the vaccines. You don't even need an appointment. You can just walk on in. So that's great news for the town of Hudson, and it's so close to home. So that's the easiest and best way to get it.
Yeah, that is the best way then. I didn't realize they were taking walk-ins.
Just recently.
That's a big step towards when I was first looking, trying to get an appointment, and getting on the phone or looking online and trying to figure out how to do it. So that's a whole lot better than where we were a number of months ago, that's for sure. It does look like other states are starting to open up a little bit quicker than Massachusetts. I think you've got New York, Connecticut, and I think New Jersey are going to be opening up probably mid-May. I see nothing wrong with, we've gone so far being cautious. I'm certainly in agreement with waiting, a little bit longer and being a little bit more careful about it. Would you agree with that?
Yes. So at this point, so every Friday I update our vaccination report, and at that time on Friday, only 34% of our population is fully vaccinated. So that's not herd immunity at this point. That 54% had received at least one dose. So that means they're on their way. But with only 34% being fully vaccinated, that's not quite herd immunity. That's not enough people that we can safely open up to where we used to be and consider ourselves in the new normal. So I completely agree. I think being cautious, it's just a little bit longer. I know that everybody's mental health may be suffering, and I think that we're gonna see mental health problems, behavioral health issues after COVID for quite some time, and that's just the next phase of our COVID-19 response. But if we hold on for just a little bit longer, I think we'll be in better standing.
Yeah. I've been under the impression, listening to the Dr. Fauci types, that what we really need to, where we need to be is somewhere around that 70, 80% in order to have that quote herd immunity. But I think as a state, if we continue to be cautious and continue to increase the number of vaccinations, at least we might be a little safer in a state, and you might want to be a little more cautious when you go out of state, depending on where you're going. The other thing that it's amazing how quickly the time goes. The other thing I want to just touch on, Kelly, two other issues that I think are important. You have coordinated with Marlborough over the past number of years for a hazardous waste day. And I see that you've got another day coming up on 5/22, and it's going to run from 9 o'clock in the morning till 12 noon. And it's in Marlborough, 860 Boston Post Road, which is Route 20. And as I recall, the last time I went up, there were plenty of signs indicating that you were in the right place and to basically turn here. Tell me about that. Has it gone well over the years? I presume you wouldn't be continuing to do it unless you had a good turnout, and we had a number of people that showed up properly. disposing of their hazardous waste. So maybe you can just talk a little bit about that as well.
Sure, yeah, it's gone exceedingly well over the past many years. We actually haven't had a hazardous waste day since 2 falls ago. So what would that bring us? Fall of 2019, because COVID hit and we didn't hold our spring event. We did not hold a fall event. So this is the first event that we've had in over 1.5 years, maybe 2 years. And I think it's going to be a very busy event. I think that the townspeople of Hudson, they are very good at properly disposing their hazardous waste. And this is a great event. It's free of charge. You come in, you get to see your wonderful health department and give us a smile and go on your way. So we're excited to bring that event back to the community.
Good. If people are interested in that, they can go on the Town of Hudson website, and there's a couple of blurbs about it. And it also advises you what you can bring and what you shouldn't bring. And just one more topic, and this is really unfortunate. I know you were working very hard to come up with a Hudson curbside, and unfortunately, COVID-19 just hit you in the wrong spot and kind of brought that to a grinding halt, I think. Maybe you could just give us an idea. I know it actually even came up at town meeting, and one of the citizens got up and asked, what the status, of the program was. So can you just give us a status, if you would, Kelly?
Sure, yeah. So we were so excited for that program. That was a program that we were going to implement in 2020. I believe it was going to start in August. Unfortunately, that came to, as you stated, a grinding halt because of COVID-19. Unfortunately, I didn't have the time of the day or the time of the year to address to curbside pickup. I am excited to bring that back. Hopefully, it will occur sometime in 2020, fiscal year 2022. Our attorney is still taking a look at the contracts. So there still are some back end work that need to go through that had previously gone forward and came to a halt because of COVID. So we hope to get that up soon. I don't have a date, but I promise to get the information out as widely as possible when it does start. And I hope that that's sometime in fiscal 2022. I do hope to take a vacation this year and have a couple weekends off. So that would be nice too.
Well deserved, Kelly. And I'm sure that, the program came to a halt, not because of lack of negotiation, but rather COVID-19. And it's disrupted, so many things in our lives and everything. I don't know if we're ever going back to the old normal. I think there's going to be a new normal
there will be.
for an extended period of time. And then at some point, that new normal will be the old normal. So we'll get through it just like we get through everything else. All right. Well, listen.
Humans are resilient.
Arthur is usually the guy that watches the clock. So I've been watching the clock, and unfortunately, we've come to an end. So Kelly, I want to thank you so much. I appreciate what you do. The town of Hudson appreciates what you do, and very specifically the Board of Selectmen. So thank you, Kelly, and maybe we'll talk again in another 4 or 5 months or whatever.
That sounds perfect. Maybe I'll have some more updates on the curbside pickup at that point.
Good. All right. Thank you.
And thank you so much for having me today.